The following ShishMed podcast is a production of drpodcasting.com.
This is a special podcast produced on site at ShishMed Connections 2019 annual conference in Nashville, as we talked with keynote speakers and session leaders direct from the show floor. And we are happy to have Dr. Zev Neuwirth with us. Dr. Neuwirth is the Chief Clinical Executive Officer for Care Transformation at Atrium Health. He is also the producer and host of an award-winning podcast called Creating a New Healthcare and author of Reframing Healthcare, a roadmap for creating disruptive change. His keynote, Why Medicine Must Adopt a Consumer-Oriented Marketing Mindset. Dr. Neuwirth, welcome. We appreciate your time here. Can you give us a brief overview of your keynote?
Sure, my pleasure. Thanks for inviting me. So the keynote is really sharing a very, very simple idea, which I think is critically important for the future of healthcare and the future of health in our country. So we've been trying to fix healthcare for decades, and it's not getting better. In fact, some would argue it's getting worse. The costs are increasingly unsustainable. It's unaffordable. Health outcomes in terms of quality and safety are not getting substantially better. And so we keep on trying the same things and hoping for a different sort of result, and we throw more technology at it, and nothing's really showing us the way out of this dilemma. I think fundamentally we need to reframe our complete orientation to the problem. And this is the orientation or reorientation. It's what I call the consumer-oriented marketing mindset. And again, that idea is really, really simple. Healthcare is fundamentally about people, okay? It's about people who have either physical, emotional, relational pain or problems or conditions, and they need help. And the only field I know of that really helps us in terms of its science, its technology, its tools, its approaches, helps us understand how to understand what people need, how to deliver it to them, and how to know that we've actually delivered what they need and want. The only field I know of that has all of that is called marketing. And so what I'm talking about is the essence of marketing. I'm not talking about selling healthcare or marketing healthcare. I'm talking about using the principles and tools and techniques and science of marketing to actually transform healthcare delivery itself.
So let me ask you this. This marketing mindset, this set of customer-oriented principles, it's used in many other industries, but you say it's not in healthcare. Why is that?
Yeah, that's a great point. Every other industry, it is so fundamental that when I talk to people in other industries, they just kind of shake their heads and they say, what are you talking about? This is just how we think, how we work. In fact, I was talking to Marcus Osborne, who is an executive at Walmart. I had the opportunity to interview him on my podcast, and we've spoken many times since. And he's in charge of health and wellness. In fact, he just launched Walmart's first primary care office in a while. It's a remarkable achievement. I suspect that they're going to offer many other products and services, but it's terrific. And Marcus actually put it this way. He said to me, hey, Zev, the difference between the rest of us and you guys in healthcare is this. You guys are customer also. We are customer only. And that's all the difference.
Wow, that's really, really interesting. All right, so let's touch on the Reframe roadmap, which you're calling for. How does that work? Tell us about that.
Yeah, so what I've observed, and I didn't make this up, I've been spending years looking and observing at other industries and new entrants into healthcare and some of the leading entrepreneurs, really accomplished organizations, and even some of the legacy organizations. And I've distilled a pattern that I've seen of success. And I've also distilled a pattern. If you don't follow all of these steps, you won't actually achieve the outcome you want. And the steps there's 7 steps on this roadmap. The first is to reorient your thinking. And again, I think the consumer-oriented marketing mindset is the major orientation. The other one I would add is what we're called the social determinants of health. I think those are the 2 major reorientations. Then within that orientation, you have to redefine your problems. You're not going to solve the same problems. In fact, that is one of the biggest mistakes I see. We keep on solving for the same problems we've been solving for decades. We have to stop. We have to get the new problems and start identifying them and solving for them. Then once you define the problem, then you have to actually define your value proposition, and that's called rebranding. And through, again, the consumer's eyes and through what they want. And once you understand your value proposition, then you have to start to redesign what you've been delivering, how you've been delivering it. And what I found is that when you start to redesign, you also have to have new results. And then the next step, which is a big, big step, is the step of reorganizing. And everyone gets stuck here, and there are great examples of this, but the organization that took you to where you are is not the type of organization that's going to take you into the future. You have to reorganize. And then finally, the real launch of this, and to get off the launch pad, is redirecting your strategies, tactics, and resources. Unless you put your money where your mouth is, if this is just a little initiative or a little side project, but you're going to keep on doing what you're doing, it's not going to work. And so those are the 7 steps of the roadmap.
So the 7 steps of the roadmap, I really like that. Curious about one of them. You said we keep solving the wrong problem. What is the wrong problem we keep solving?
Well, there are many, and this is human nature, right? I mean, you and I, if given the choice of solving a new and different problem and a complex one, we would choose the ones we're familiar with. I mean, this is why everyone does emails. It's such a simple problem to solve, right? I mean, and for healthcare organizations, they solve, they're solving the problems of their technical problems, their human resource problems, their internal facing problems, how to grow, how to get bigger, how to, even the problem of efficiency. Now, continuous improvement, don't get me wrong, we have to continuously do that. That is just part of your day job, always getting better. That's not the type of problem. And it's not even innovating. It's not even creating new services. The type of problem that is really on the table right now is how do we completely reorient and reframe healthcare delivery.
And it sounds like we need to reframe our efforts toward the customer. As you said, Walmart has a customer-only focus, where healthcare seems to have a customer-also mindset.
Right.
So we should all focus on the consumer and solve their problems.
You know what? I think that's such a great point you're making and emphasizing. When we sit down to construct new products and services in healthcare, we typically get a few execs around the table, a few physicians and other providers, and we say, hey, what do you think we should do? Let's create a new service. Let's create a new product or something like that. That shouldn't be the question. That shouldn't be the problem we're solving. We should ask, what is the experience that our customers are needing and demanding, and start from that, and then let what we want inform, as opposed to saying, well, I got a new tool, new shiny technology, let's build on that. That's not the way you solve consumer-oriented problems.
Right. So define that problem and then first. And then people will pay more attention to you even once you define that problem. Once you say, are you struggling with this, or how many times has this happened to you, or whatever, and then you come in with a solution, people will inevitably pay more attention to you anyways, once you define that problem first. It's really important.
I think that is I actually say that the keystone to the entire Reframe roadmap is redefining the problem. And if you look at innovators throughout the past few decades, they all say the same exact thing. You look at someone, again, I know everyone talks about this, but look at Steve Jobs. Steve Jobs was not solving the same problem everyone else in his industry was solving for. He defined a completely new problem to solve for, right?
Right. Absolutely. Well, in marketing, people pay more attention to you when you talk about their problems and how you're going to solve them, right? Instead of just talking about yourself. Here's what I do. I'm cool. Instead of, you have this problem. Here's how I'm going to help you solve it.
It's absolutely true. They call this, and different people have different ways of talking about it. They call them pain points, right? And that's what it's about. If you solve my pain points, I'll forgive you for a lot of things, right?
Right, absolutely. So can you share an example or two of the Reframe roadmap and how it's turned out?
There are hundreds and hundreds of new entrants in the market that have taken the marketing mindset. So, for example, principles like segmentation or even hyper-segmentation, focusing on a small... Because this is one of the errors we make in healthcare. We try to be everything for everyone, everywhere, all the time. And when you try that, you end up being very little for anyone. And I know it sounds funny, but it's so true. And I will tell you, I've had this argument for years with my colleagues. We cannot be everything for everyone. Now, you look at an example like care of the older patient, very, very sick. We call it complex chronic care. So we try to do this in the course of our everyday work as we see everyone else. There are organizations now like ChenMed and Eora Health and CareMore that say, no, all we're going to do is take care of the older patient, the older person with complex chronic medical problems. and they are just blowing the doors off of it. That is the place I want to go to when I need that kind of help and when I'm a bit older. All they do is complex chronic care. They hire the right people. They hire people who are passionate about it, who are skilled at it. They staff it correctly. They have their own electronic medical record system that is just focused on that. They have the infrastructure. They have the resources. They create the culture. They create the strategies, tactics, and resources. They are doing the Reframe roadmap and the marketing mindset, and their results and their outcomes. They're keeping people out of the hospital, out of the emergency rooms, away from specialists, away from unnecessary tests and imaging and procedures. And they're actually seeing the patients more, and they're doing better financially.
Right. Well, it only makes sense. When patient satisfaction increases, they're going to talk about it more. You're going to get more word of mouth. So you are going to grow when people start to hear about your organization. So that's just a matter of really refocusing, using the Reframe roadmap to focus on a certain segment and really be all about the customer. That's what it sounds like you were saying.
It is. It's using the basic principles and also some of the more sophisticated tools of marketing. I think there's another example I'd like to share with you, which is, and again, I think the reason I'm doing this is because I think that legacy organizations, hospital systems, healthcare systems in healthcare today can and should and must be doing this. Two great examples are Intermountain Health and Renowned Healthcare. What they've done is they've rebranded, redesigned, and reorganized. It literally is the 3 steps of the marketing mindset: rebranding, redesigning, reorganizing. And what they've realized is that there's actually 2 fundamental brands, and they were in conflict and they were mixed up together, and they separated them out. They realized both, for instance, Intermountain has a hospital brand division where they do amazing hospital care, ICUs, intensive care units, surgery, etc. And then they have a community care brand. Those are 2 different brands, 2 different divisions. The value proposition of the community care brand is to keep people out of the hospital, right? So they're not in conflict with each other. They're actually working together, but they're separate, okay? Renowned Healthcare under Dr. Tony Slonim did something very similar. It was brilliant. He has a care division, again, which are the hospitals and rehab centers and urgent care centers and doctors' offices and specialists and surgical suites. That's their care division, okay? And they do phenomenal work there. But they have a separate division, which is called their health division. And that is their community care division. And there they focus on helping older people age well. They focus on helping children prevent car accidents, get immunizations. They focus on behavioral health issues, on the social determinants of health. And again, they are free to live their brand and to deliver on that brand without any conflict with the other brand. In fact, they're complementary and synergistic. Those are 2 examples of large, very, very forward-thinking hospital systems that have been following the marketing mindset and the Reframe roadmap.
Absolutely. Great example. And thank you so much for sharing both of those with us. The keynote, Why Medicine Must Adopt a Consumer-Oriented Marketing Mindset, with Dr. Zev Neuwirth, Chief Clinical Executive for Care Transformation at Atrium Health. Thank you so much for talking with us today. We really appreciate it.
My pleasure.
Thank you. And if you were unable to attend SHSMD Connections 2019, you can access the session recordings by purchasing the virtual conference. Just visit shsmed.org/virtual conference. And please join us at next year's conference, September 13th through the 16th, 2020, at the Hyatt Regency in beautiful Chicago, Illinois. And if you found this podcast helpful, please share it on your social channels. And to access our full podcast library for other topics of interest to you, visit shsmed.org/podcasts. This is the SHSMD Podcast, Rapid Insights for healthcare strategy professionals in planning, business development, marketing, communications, and public relations. I'm Bill Klaproth. As always, thanks for listening.